morning. Welcome. Thank you so much for attending our annual end of career retirement seminar. So if you are here, congratulations, because that means that you are eligible to retire. Who is ready to retire? Yes. All right. So we also want to thank all of our members who are joining us virtually. We are live streaming this on Zoom. So welcome everyone. Thank you. And I would like to introduce my staff to you. Coming up to do the next presentation will be Corey Rowland, our Manager of Member Services. In the back, doing our our Communications Manager, our maestro back there is Jeremy Rowell. I also have one of my Member Services Analysts, Sam Westbrook, in the back. We have Jessica Macias. She is one of our newest members, and she is an accountant on our team. And then next to her is our other Jessica, Jessica Quintero, and she is one of our other Member Services Analysts. So any questions during the breaks or after the presentation at the conclusion of it today, if you have any questions, they would be your best resources for KCERA related questions. Now, you have climbed the mountain and you are right now at the door ready to take the steps into retirement. So congratulations on that. And our plan hopefully is for today with these presentations that will help you prepare and plan for the retirement that you not only want, but that you deserve. So we want to make sure that the questions that are unanswered are answered for you, and that you know what to expect when the time comes and that you're prepared when you get there. Housekeeping, few little housekeeping rules. The Board of Chambers, there's no food or drinks allowed, just water. So we appreciate you sticking with that. And then if you could please silence your cell phones, put them on mute, turn them off so we can be respectful to our neighbors and all of the presenters. We appreciate that. Parking. So if you parked in the parking structure, you are perfectly fine. Even if you parked in a 2-hour, they are not going to be ticketing today until after the presentation is over. If you parked in the back lot or over at Superior Court, you're also okay. If you parked over here on N Street, not 1-hour parking, meter maid will get you. So you may want to move your vehicle if you did park over in that 1 hour. Restrooms, if you have not been here to the admin building, there are restrooms right outside the door and to the left. If that line gets really long, upstairs on the second floor, there's also restrooms up there. We will take a break around 9:45-ish. Just depends on the questions and the lengths of the presentations. We'll try to stick to our schedule today, but we will take that break about 9:45. And we should wrap up around noon. Once again, depends on the questions and the presentations. Sometimes I get a little long-winded, but I'll try to stick to the schedule. Every one of you received a packet today. Y'all got your wonderful packets. Inside your packet, you have a business card that is actually a magnet. And then inside your packet, on the right-hand side, you will have printed out presentations of the, printed out PDF versions of the presentations that we will have for you today. And there's blank sheets in there so you can write notes also. On the opposite side, you will have your agenda for the presentations today. At the bottom, you're going to see a QR code. This will lead you to our survey. And if you could do us a favor and complete the survey at the conclusion of our presentation today, we would really appreciate it. This just lets us know if there's any ideas that you have or anything that you think that we could expand on, or if we did a great job and Sherry's presentation was amazing and off the top, then you can just say, oh, 5 stars. But if you could take care of those surveys for us, we'd greatly appreciate it. We also have an additional contact sheet for you, just different contacts for anytime through your career, but also after retirement. And on the back side, this is not an exhaustive list, but who to contact and when you're getting ready to retire. And then the last form that's in your packet, we call this our end of life essential form. This doesn't have to be just for your retirement, but this is a fantastic form for you to keep and fill out and have it in your important documents, because if something happens to you, whoever is handling your affairs, they can use this when they go to the mortuary or whomever is handling your burial. If you fill this out, this is the information that is on the most all death certificates. And it makes it so much easier for your family member or your representative when they're filling out that form. And then on the back side is just different places that your family members or representative would need to contact to advise of your passing, and whether you need an original death certificate or a copy. A lot of agencies will take a photocopy so your loved ones don't have to purchase an original death certificate. But that's the extra form that's in there for you as well. All right. You do get, if you have not attended the presentation before, the Board of Supervisors approved that each of you receive up to 4 hours paid to come to one of these presentations. At the end of this seminar today, we will give you a attendance confirmation sheet for you to provide to your payroll clerk or your department to prove that you were here. If you do have to leave early, I ask that you speak with one of my team members, give them your name and your department number so we can write that down for you. And like I said, if you've already attended before, then you'll have to use accruals and handle that with your department. All right, so my name is Sherry Willard. I am the Deputy Chief for the Member Services Division at KCERA. I have been with KCERA for 21 years, and all of that has been in the Member Services section. So it is definitely my honor to be here and do this presentation for you and help you prepare and be ready for the next step, taking you into the next journey of your life, which is retirement. So get started. I'm going to go ahead and introduce Corey Rowland, our Member Services Manager, and she is going to talk to you a little bit about REOKC.
Good morning. Like Sherry said, my name is Corey Rowland, but today I'm going to be talking about what we call Retired Employees of Kern County, which is a separate agency from KCERA, but we are kind of affiliated. So has anybody heard of REOKC or Retired Employees of Kern County? One, that's it. 2, 3. All right, we're getting better. We're getting better. Well, I'm glad you're here because I'm going to be able to explain what it is. So Retired Employees of Kern County is a nonprofit organization that was established in 1964. So they advocate for safeguarding and the continuance of your retirement pension and your health benefits. So they ensure proper representation on the KCERA Board of Retirement, and they also provide avenues of support and information for retirees and, of course, the survivors as well. It is a separate, like I said, it is a separate organization from KCERA, but most KCERA members, we encourage you to sign up because they do provide a lot of retirement information to you. They have monthly luncheons that you can go to at Hodell's. And so there will always be like a representative from KCERA. They normally have someone from Voya there, or Deferred Comp. They have someone from Strata. They have like a travel agent that goes and talks to you. So again, it's a monthly luncheon that you can go to. They provide information. There's additional speakers. Sometimes they'll talk about fraud. Sometimes they'll have a speaker maybe about traveling tips, with summer coming up and things like that. So they have different speakers on different topics. You do have to sign up to be a part of REOKC. It is $2 to sign up. It can be taken out of your KCERA check monthly. Once you sign up, you do then have the benefits that they provide, like going to the monthly luncheon, which is $6 a month. It is at Hodell's. It's a great luncheon. I've been a few times. I enjoy going. But then they also have additional benefits as well if you sign up. So when you submit your retirement application packet, we are going to mail you something that looks like this. It'll come from our office, but it is for REOKC. It'll come in an envelope that looks similar to this. Now, you may come into our office and drop it off. We may hand this to you depending on, how you submit your retirement application. But this is what it'll look like. And it's going to have the sign-up form that you will submit to REOKC, and then it's going to have a booklet, an enrollment booklet with it. In this booklet, it's going to have things that they offer. They offer pet insurance. They offer travel insurance. They also offer different things from PGA, which PGA is here, and they're going to speak after me. So they offer different things if you sign up for the $2 a month. If for some reason that you don't receive this packet, or maybe you've misplaced it, please don't hesitate to contact us or contact REOKC. They also have a website that has their form on there that you can sign up for, but you can always contact us as well. They also offer scholarships. So this year, they actually, we believe they gave out 14 scholarships to 14 different people. So of course, this would be somebody who is related to you, either a child, grandchild, niece, nephew. If you are a member, then they can apply for that scholarship. It's a $2,000 scholarship that they give out, which I think is a great benefit. It is limited to only one per member, though. So if you do want to know more information about REOKC, we do have the benefits guide, like I said, in the packet. There are some on the back table as well. You guys may have already grabbed them when you came in. Along with brochures, their website is reokc.org, or you can email them as well as contact us at reokc.org. I am now going to pass it on to PGA, Steve from PGA, and he's going to go over some other benefits. So if you do sign up for REOKC, then you would be eligible for these benefits. Steve?
My pleasure to be here. Can everybody see me okay? No problem seeing me, but if you can hear me, that's better. I'm glad to be here. I want to thank you. I have some associates with me today. Sorry, I'm a little croaky. That happens. But anyway, I have Vivian Reyes. She's our associate from our office here in Santa Clarita, California. And then obviously we have Debbie, her last name is Detner, I get it pronounced right, is our representative here also, and she is here also to say a few things about some success stories we've had. I am very happy to be here to talk, basically to tell you that this is a special time, and a big thanks obviously to Sherry and obviously Jeremy and Corey and all of KCERA for this opportunity. We haven't done this, I don't believe, in the past, but I think it's a good thing to have this as the next step in your trip to retirement, and also to cover the things that your plans may need. As you get older, I think everybody knows that, things change. You have things that have to be taken care of. Usually your hair gets grayer, your dental needs get changed. Usually they're a little more, almost as much fun as a root canal. People keep telling me that stuff, but all these things are extremely expensive. And what we have are supplemental plans. As Sherry was mentioning, if you join the engine of this benefit, supplemental benefits, if you join REOKC and you become a member, it gives you entree to group level benefits. We have now partnered with a huge company called AMBA, and what they do for us is they handle 40 different association groups. Many of them are retired, and they're able to focus on the specialized needs of retirees. And that's why obviously we're here today to help you take that journey together. I think we have a next slide there. I don't know if I'm supposed to hit something here. It's right there. Just do this, just push the button. I don't have my teenage grandkids here, actually. Sorry. Sorry, yeah, if you can. It's right there. Oh, hello. Where's my glasses? I'm telling you, that's why you have vision. Okay, sorry about that. Well, obviously, I was just mentioning, we've been around since 1953. So just to give you a little story, it's been around a long time, longer than myself even. So I'm happy to say that. But we're here to help you. They specialize, as I was saying, customized programs that are group benefits. You can't get these on individual basis. Everybody says, well, I can go to VSP and yeah, but it's around $17, for a single coverage per month usually. But these plans are a whole lot less expensive and excuse me, very comprehensive as well. That we deliver obviously the cost-effective approach, that we're able to put these plans together and make sure the carriers give you the best options available. These are benefit designs that are the most comprehensive and obviously the benefits that you need. And that also what they do is they keep your costs down because they are very definitely, we haven't had a rate increase, in 6 years, I think it is. So it's extremely good, especially costs do not go down usually as everybody is well aware with inflation. So the other thing is we focus on the innovation of plans for you. And we're going to speak to those in just 1 second here. Which the thing to switch it up one more time. Okay. Yeah. The most popular plans obviously are dental and vision. The dental plans, we have 2 options for you. You either go PPO if you want to keep your own dentist. If you're lucky enough to have your dentist be in the network, and about 90% of the dentists are in Emeritus Dental PPO network, then you're getting up to like a 50% off the going rate. So if you said, say a $1,200 crown, you would get that more like around $700 would be your charge. Do you see what a discount can give you if you stay in a network that's huge? A PPO network called Emeritus is the dental plan that we're talking to you about. We have lots of information on that. It has a huge network. It's national. So if you're going to go off to Montana or wherever, you're going to take off to with RV Nirvana, I think it was called. If you do, then these plans you can take with you because they definitely travel well. The other thing I was going to say is there's a low and a high option for the dental. If you want, it's cost effective. If this is the year where you're going to have just minor restorative, not a lot, you might go with a low option on that PPO supplemental. If you're expecting a higher cost, you could go to the high option as well. And that one obviously is a better benefit. It's a little more expensive, but that's what you would expect. There also is an HMO plan here called Cigna. It's the biggest that we have. It is extremely well. I've been on it for a very long time. I've had a root canal on it, been extremely happy with it. So I can just tell you, if you haven't looked at HMOs, if you're not married to your dentist, you could probably make that switch because they have a smaller network, but those plans are very comprehensive. The vision plan, as I mentioned, is VSP. That's the most popular and probably the largest PPO out there. Definitely don't forget your annual eye exams are included in this program so that you can have that done. Macular degeneration has been a problem my vision ophthalmologist has told me about, and I use it all the time. And we get these annual checks and they can keep you from losing your vision, which I believe is one of your most valuable physical assets for sure. The other thing is you have your eyeglasses and contacts are also covered under this with the frames, which can be quite expensive. But with these plans, you can go in and pick off ones that you prefer, and you can have these done at very cost-effective use of the plan. And you pay these premiums, and they're very, very inexpensive for what you get. And the next slide, please. The additional plans that we're talking about is their Legal Shield. People say, why do you need legal insurance? Where everybody's today is in the legal lotto is what's going on out there. Seems like everybody's suing everybody. You can't get people to do things. The only thing that really works is when you get an attorney to write a letter to a neighbor that no longer wants to talk to you about the problem with his tree and your plant in your driveway is what I'm telling you is they write a letter, and it's just like the IRS. They're going to read that letter. And it gets results is what I'm telling you. So if you haven't done that for like around $15 a month, that's incredibly good pricing on this for that. And if you get sued or go to court, the defense is covered under these plans as well. So just so you know, these things can really help you on that. ID theft is over 33% of the US is being frauded lately. I think it's higher than that, quite frankly. Every time I turn around, I'm getting robocalled to death. Somebody's phishing your system. Somebody's trying to steal your data off your cell phones. If you get breached, can happen, by the way, very easily. In this day and age, this ID theft program, ID Shield, I call it, will help you protect yourself from ID theft, can help you fix it. I don't know if there's services out there that will tell you how to fix it, like they can tell you how to program your computer, but I can't do that. I can't even run a projector here. But I'm telling you, if you need help, these people will fix it for you. This is what I'm telling you. This plan is different. It's better. And when you get into the nuts and bolts of these plans, I think you'll see that there is a competitive advantage, what these plans can do for you on the long haul for stuff like that. The other thing is home warranties. People said, what about, my refrigerator died on me. Everything seems to be breaking down. Everything has a motherboard. If you've got this, that, oh, we don't work on that. How do you fix anything anymore? And everything is very expensive. What I'm telling you is, if you haven't looked at a home warranty program, take a look at this one. This can cover you for everything that you can think of. And if you need a custom-made plan, if you had a pool or something like that, you can also put that in there as well. So these are things that I'm telling you to take a look at. Give us a call and we can help you with that. Next slide, please. Okay, we have a new program. My wife is a little hard of hearing. Especially against me, but she had an infection and that kind of thing, but she has used this service program and it saves like about 50% off on the cost. If you haven't priced a hearing aid lately, make sure you're sitting down. That's all I can tell you. The other thing is we have emergency assistance plans that help you if you have an RV. Not everybody has one. Everybody has a motorcycle. What happens if you have a heart attack, a stroke, you get in an accident? Who's going to bring your RV home? Who's going to drive it back? This plan covers that. That's what that plan will do for you. Also, a life insurance, there is ways we can get that quoted for you. This obviously is subject to health evidence, and it's term insurance. Everybody knows you want a 20-year term. It's for 20 years. You fix in or lock in your rates for how much you want, protection-wise. We can get those quoted. Just let us know that you want it quoted, and we'll work with you as best we can to get the best carrier and get the best plan for you. Next slide, please. Oh, here we go. She's way ahead of me as usual. My assistant here, for sure. Pet care. People say my kids are grown and gone. I've got a great grandkid now, so it's like what's up with this? But the pet insurance is the thing. When little Fluffy comes up and they want to take a walk in the morning, you take them for a walk. But you got to take care of them. They are your children now, and that's what this pet and care program will do for you. Please, if you haven't looked at it, we have an HMO version, which, doesn't have any problem with ages. It's not age rated. It's one fixed rate. It's an HMO. You have to use that network. Everybody knows what an HMO, I believe, is. That's a good thing. The other one is a PPO option for you. PPO option means you can go to any veterinarian that you would like, and that's taken care of for you. So that's the way those two plans work. And we have lots of details, and we're obviously going to answer questions after the meeting today. Am I doing okay on time there, Sherry? I was going to looking for the hook here. I was going to say, I'm about ready to duck. I'm not wearing my helmet either. But anyway, I was looking at this. Personal accident is the next one. It's our most popular product. It's about $4.90 a month. And what it can do for you is that if you get it's medical vac, medevac is what it's basically does, and lots of other services with it. It is a rider program on top of a accidental death benefit is what you get. Say you want $100,000 of coverage. What, $4.90 for like one person? Anywhere you travel, if it's over 100 miles from your home, you have this coverage so that if something should happen to you, you're on a cruise ship, you could fall down, break your hip, you could have a stroke, a heart attack. A lot of things happen when you're having fun, but the main thing is they don't turn the boat around just because you don't feel good. You know what I mean? So this plan will get you to, the closest place, and they will repatriate if you should pass away while you're on trip. So people don't realize it's like $30-some thousand. We've had it happen quite a few times. So if you haven't had this one, and I'm on this myself, and I have my card in my wallet, if anything ever happens, you get medevac back is the thing. So, so that is that plan. And then, how to engage and enroll? I'm going to turn this over to Vivian at this point. She's going to tell you a little bit about, the process and how we do that. And this only take a minute. And obviously Debbie will be here and she'll tell you about a success story with the LTC. Okay, so let me step aside. And where's my latte?
Hello, you can engage with us any sort of way. You can certainly give us a call. Phone number is on the brochure, I think that was sent to you guys at 800-511-9065. We'll always answer the phone for you. There's always a person that's going to answer the phone. We might not at that time generally, but we definitely will give you a call. You can go to the website at pgagencies.com /REOKC. You can also go into the REOKC website, and they should have a link there for PGA. And those are the three. That's it.
Good morning and congratulations. Yay, you are almost done, right, everybody? Yay. My name is Debbie Detner, and I've worked for this company for about 6 years now. And I wanted to share kind of something that happened to me and who I am. I am here for you. When my clients become my clients, they become part of my family. I'm a little pit bull when it needs to be to get what needs to be done. But I had the pleasure, I walked into a city office and talked to an HR manager a while back, and we were talking about, long-term care, and some of the challenges were, in getting it for some of my younger groups in terms of like my police officers, my firefighters, my correction officers, because their bodies are it's a physical job, so they tend to need it sooner. And we're just chatting about that and getting to know him. And it was a great visit, and said goodbye and kind of set up a plan. And about a month later, I get a call from an older gentleman, and he's really very kind. And turns out it was his father. So I felt so honored to be referred by my HR manager to his father, because that means hopefully that he trusts me. Anyway, the father was on his wife's healthcare plan, and his wife was retired unexpectedly. And so they were trying to navigate what to do with healthcare, because he was eligible for Medicare, but they didn't know if that was the best plan for them. So I worked with them to talk about what works better. Should they go both on the COBRA? Would Medicare make more sense? Medicare Supplement, Medicare Advantage, educating them on all their choices and finding the best plan for them. And so I was able to help them navigate, and we got a plan set up for when she's ready to age into Medicare as well. But I felt very honored to be able to kind of serve them. And I thought that was done. And then about a month later, I get another call, and it's from their younger son, who was working a part-time job, and he was on Covered California. I don't do Covered California, but he had let his policy go. And once you get off policy, sometimes you have to wait an entire year to get back on during open enrollment. But he had health issues, and it was imperative that he find a plan. And we were able to navigate a loophole for him. I couldn't write it for him because I don't do that, but I felt so appreciative that they trusted it for me. He was able to get back on his insurance. So it was a way to help serve the entire family. And I felt very honored to do that. I am here locally in California for you. I think in terms of insurance, I will point out that California is a rare bird. We are different from any other state. None of our laws, and as we all know that, but none of the laws here are the same as elsewhere. So it really does make a difference when you're speaking to someone who knows the ins and outs, especially with things like long-term care. But I am an expert. I have my cards out there. I'm more than willing to give you my phone number if you would like it. Feel free to come and grab my card, and I'm here for you. So we hope to serve you and help you navigate the next step in your life. And may it be enjoyable and pleasurable and travel all you want.
Right. Thank you so much to everyone at PGA. That was a great presentation. This is the first time we've been able to have them join us at our seminar, and I definitely see this being an ongoing thing. So that was some great information for you guys. So next up is going to be Jocelyn Reyes with the county health benefits, and she's going to go over the retirement insurance coverage for retirees. So.
Okay. Okay. Good morning, everybody. My name is Jocelyn Reyes. I'm with our health and wellness team for Kern County Health Benefits. And so I'm here today to give you a something that I did want to say is to have a retiring employees benefits plan guide in your packet for your retirement. You can also visit our website. There's a ton of information on it. It's kerncountyhealthbenefits.com. You would click on retirees, and that's where you're going to find the retiree information. Also, the information I'm presenting today is very general information. I know everybody has their in depth, so we can make sure that it's important. And I get this a lot. Some people don't know that retiree health benefits don't automatically roll over once you retire. You actually have to enroll in retiree health benefits. So your active employee benefits will end at the end of a pay period, not at the end of a month. In order to be eligible to enroll in retiree health benefits, you have to have at least 5 years of county service. You have to be receiving a monthly pension from KCERA. The available coverage to you is medical, dental, and vision. And it's not like we're active employees, that's a bundle. These are separate benefits. So you would have to enroll in each benefit, and you can choose one or the other or all three. That would be up to you. We recommend that you submit your enrollment forms about 30 days before you retire, just to make sure that you have a smooth transition. But you do have a grace period of 30 days from the date of retirement. You just don't want to wait that long. The sooner the better. If you miss that 30 days, so if you come in 31 days or you mail your forms and they don't come in 32, 34 days, you will be ineligible to enroll in benefits because you missed that permitting event. Retiring is a permitting event. Permitting events have 30 days from the date. So if you miss that date, you would have to wait till open enrollment. If you were eligible for any county contributions, you would forfeit that benefit because you didn't enroll timely. So those timelines are very important. So as an under 65 retiree, all our young retirees, you do have different medical plan options, and they are based on the service area that you live in. So like if you are going to move outside of California, you would only have certain options available to you inside Kern County or in California. So in Kern County, we have plans that you guys are very familiar with because they're plans available to us as active employees. We have the Kern Legacy Share Select, Kern Legacy Network Plus. If you are leaving Kern County but staying in California, we have the Kaiser Permanente plan and also the HealthNet HMO. If you are looking for nationwide coverage, we have the Anthem Max Choice, Kern Legacy Max Choice, and Kern Legacy Classic Choice. So you have a lot of options for you depending on where you're going to be living and what type of benefits you're looking for. We're not going to go over the plans today, but I am going to go over some terms that are really important when you're picking plans. One of them is a deductible. So some plans have deductibles. For example, the Kern Legacy Share Select is a high deductible plan. And what a deductible is it's the amount for covered services that you're going to have to pay for until the plan starts beginning to pay. And that's annually. So like if you are on the Share Select plan, which has a high deductible, $2,000 deductible, you're going to have to meet that deductible before the plan begins to pay and the copays apply. A copay, I think everybody knows what a copay is. It's a fixed amount you pay for services. So like a $10 copay to see primary care. It's a fixed amount, so you know what you're going to pay every time you have a copay. A co-insurance is a percentage of the contracted rate. So if your plan has a coinsurance, like a 20% coinsurance, you're paying 20% of what the contracted rate is for that service. If you are on a plan with coinsurance, something that's really important, all the plans have it, they're out-of-pocket maximums. But the reason that they're important on a 20% coinsurance type plan is because you don't know what that 20% is going to be. If you're in a car accident, you have an inpatient stay, you don't want to owe 20% of $2 million. So an out-of-pocket maximum is very important because that's the most you're going to pay in a year. So that's kind of your protection if you're on a plan with a coinsurance. And then I just explained the out-of-pocket maximum, so I'll skip that. And if you are over 65 or you are going to be covering a spouse that's over 65, something that you want to do pretty early, and that's why it's good that you guys are here planning for your retirement, is you want to apply for Medicare if you plan to continue on one of the county's over 65 plans. So you want to apply for Medicare Part A and B because that is a requirement in order to enroll in an over 65 plan. If you haven't enrolled in Medicare Part A and B yet, you can't enroll in an over 65 plan. So don't wait till the day you retire to apply for your Medicare because it does take some time to become eligible. When you are 65 and older, you are not required to apply for that Medicare yet, and you probably haven't because you have employer-sponsored insurance. But when you go to apply for Medicare, they're going to want proof that you've had that coverage since you've turned 65. So they're going to want you to fill out a form. It's called a CMSL 564. That form is something that us in Health Benefits, we can help you with. We would be completing that form for you, and you would present that when you apply for Medicare. So again, make sure you do all those things timely. With the over 65 plans, it's not like the under 65. Under 65 plans will start as soon as your coverage ends for your active employment. With the over 65 plans, the Medicare plan can't start outside of the first of the month. But normally when you retire at a partial month. So you still have days remaining in the month. So what the over 65 employees need to do is enroll in an under 65 plan to bridge the gap between your retirement date and the first of the month coming. So you want to make sure that you submit 2 enrollment forms. It's going to be an enrollment for an under 65 plan that will end at the end of that month that you retire in. And then the first of the month, you will start on your Medicare plan. Failure to apply for Medicare. So if you don't apply for Medicare till the date you retire and you don't get your Medicare until 2 months after you retire, you've now missed that grace period, and not having Medicare, failure to apply on time, is not an exception to the rule for the permitting event. So that 30 days still applies. So you want to make sure you do everything timely. So now I'm going to talk about county contributions. So county contributions is an amount that you may be eligible for that will be applied toward the cost of your medical premiums. It does not go toward dental and vision, only medical. So the first is the stipend program. The stipend program, to be eligible, you have to be a county retiree, not from a special district. You also have to elect continuous coverage. So when you retire, you have to elect county coverage. The amount of the stipend depends on the number of people that you will be covering on your medical plan, your retiree medical plan. So if it's just yourself, it's going to be $39.75. If it's 2 people, $53.69. And for a family, $61.50. And this amount gets deducted from the cost of your medical premium. If you leave county retiree coverage and you are eligible for the stipend, and then you choose to re-enroll in county benefits at a later time, you temporarily lose that stipend. But as long as you come back and you're back for 3 consecutive years, that stipend will be applied to your benefits again. And then we have the Retiree Health Premium Supplement Program. So with this program, retirees under 65 qualify. If you were eligible for it, but you're 65 and older, you no longer qualify for that benefit. The general eligibility requirements are that you must have contributed to the program. So that's a deduction that comes from our payroll now. You'll see that on your payroll sub. So you have to have not opted out. If you opted out of the program, you opted out for both the supplement and the stipend. You have to elect retiree medical coverage at the time of retirement in most cases. You have to have at least 20 years of service. So if you come in and you're at 21.2, you're not, I'm sorry, 19.2, you're not eligible for the program. It has to be at least 20 full continuous years of service. And there's some service that qualifies you when you are looking with KCERA for your pension, but is not program eligible. So that would be like any buyback that you did. So we've had people that maybe they worked 5 years of extra help and they bought their time back. That does not count toward this program. The only time that counts is the time that you're paying into this program. So it's important even when you come see me and you want to know like generally how much am I going to pay? What's my stipend going to be? And supplement, if you tell me you have 20 years of service, but it's not continuous service, you may not get the right information. So you want to make sure that you kind of tell us the whole picture when you come in so that we're able to give you the best information. You have to take active retirement from service. So if you separate from the county now and you come back, you have a deferred retirement, you had forfeited your benefit. You have to retire from active service. And again, you have to be between the ages of 50 and 64 because the month that you turn 65, you become ineligible for that benefit. The supplement, it's calculated at the time of retirement and it remains the same until you become ineligible when you turn 65. So it doesn't change each year. It's the same as it was when you retired. The supplement ends again when you turn 65 or if you leave the county. So if your medical insurance coverage ends, your supplement will end. If you come back, you will not get that supplement again. So these are the current supplement contributions, and it's based on your bargaining unit. So I'm not going to go over all of them, but you will get 50% of the total value of your supplement at 20 years of service. And then for each year up to 25 years, you get another 10%. So you get the full value of that supplement when you are at the full 25 years of service. And right here, this is just an annual medical plan cost comparison. Whenever you're looking at your plans, it's best to kind of look at what you're going to be paying over a year than a month, because then you get a better picture of what the plans are going to cost you. So the examples here, we're comparing the Anthem Blue Cross plan. So we're comparing the classic choice to the max choice. And the max choice might be a little bit scary because it has that 20% coinsurance. But remember, there's also an out-of-pocket max. And if you see the difference, you're getting a benefit that has Anthem as the network. So you have that nationwide network. But the Anthem plan that is the classic choice is going to cost you a little over $22,000 a year. Where if you're on the max choice, even if you have that $5,000 and you meet that in a year, it's going to cost you $6,900 each year. And this chart is showing if you were eligible for a supplement and stipend. So remember, if you're not eligible for the supplement and stipend, you are going to pay the full premium. So here's another example is the Kern Legacy Share Select and Kern Legacy Network Plus. So if you were going to be living in Kern County, all your doctors are in network. A high deductible plan might be scary. You don't want to pay $2,000 deductible. But if you look at the cost, if you're eligible for a stipend and supplement, you are going to be paying nothing in your premium, but you do have that $2,000 deductible. So you just have to be aware of that and have that money available so that you can pay for services until you meet your deductible. But that's in comparison to the Kern Legacy Network Plus that also uses the same first tier of providers, the EPO tier. For that plan, you pay $4,358 a year. So this just gives you just a little comparison for you to do when you're looking at plans, and it gives you a better idea. So I always suggest that you look at the annual cost. So now we're going to move on to dental coverage. Right now, as active employees, you have a PPO and an HMO available to you. When you retire, our plan is an HMO plan. The coverage is in the state of California only. There's no out-of-network benefit with an HMO. So you do have to go to dentists and providers that are contracted with Liberty's HMO network. You have no deductibles, set copays for many of the services, no cost for most preventative services, and no annual maximum. So I know some of you that are on a PPO plan right now, there's an annual maximum that they'll pay per year. This HMO plan doesn't have an annual maximum benefit. If the HMO just isn't for you, you're going to be moving out of state, you need a plan with coverage outside of California, or maybe your dentist is only providing services in a PPO, you could temporarily continue your PPO plan that you have right now as an active employee if you do have the active employee plan when you retire. The reason that you're able to continue that is to elect COBRA. So COBRA is 18 months that you'll continue on that same plan. It's not a retiree benefit. So retiree benefits are deducted from your pension. This will be paid directly to the Health and Wellness Department because it is a continuation of your active employee benefit. So whenever you terminate coverage as an active employee, you're going to get notification in the mail. It's going to be a COBRA notification, which also serves as an election letter. If you want to continue your plan for those 18 months, you can elect COBRA with that form. It's going to give you premium amounts and you would pay that directly to us to open up your coverage. You'd have to exhaust those 18 months of COBRA benefits completely to have an involuntary loss of coverage, and that would be a permitting event to come onto the retiree's HMO plan if you wanted to at that time. Similar to what we have as active employees, we have the Vision Services Plan, the VSP. That gives you eye exams every 12 months, prescription glasses and contact lenses every 24 months. You have both an in and out of network benefit, but of course, with any plan where you have an in and out of network benefit, you save the most if you're in network. There's also extra benefits that you get as a VSP member. So they have some VSP simple values discount programs. They also do provide some coverage for hearing aids through True Hearing. And they do have Vision Rescue, which offers savings on eye care for certain essential eye care items. And I explained this a little bit after the Liberty Dental. For COBRA is a federal law, so it's something we're required to provide. And it's your right to elect temporary continuation of your active employee benefits for specific reasons. Retirement is a eligible COBRA qualifying event. So if you are on COBRA coverage, but you become eligible for Medicare, your COBRA coverage will end. Other than that, your COBRA coverage will continue as long as you continue making your premiums until those 18 months expires. The COBRA administrator for that COBRA benefit is us, the Kern County Health and Wellness Department. And again, COBRA premiums are paid directly to us. So you could do COBRA under your medical if you wanted to do COBRA medical, COBRA dental, COBRA vision. It's just a continuation of what you have when you retire. So if you're on the Kern Legacy Classic Choice and you want to do COBRA for your spouse when you retire, you can do that. But if you want to switch to the Kern Legacy Network Plus when you retire for your spouse and do COBRA, you can't. It has to be the same benefit that you had when you retired. So another benefit that we can take advantage of when we are retiring is the county paid life insurance. So right now, for certain eligible employees, the county is paying for life insurance, and we can continue that after we retire. We can port or convert that policy at the group rates. So if that is something that you are eligible for and would like to do, we can provide you the forms that you need to fill out in our department when you come in for enrolling in benefits. That form would not be returned to us. It would be returned directly to the administrator, which is the Guardian Life Insurance Company. If you have questions, you can't call them until you actually submit an enrollment form, because right now they're not going to be able to find you in the system since you are under us as the county. We are paying for those benefits. So if you're interested and eligible, or you want to find out if you're eligible, just when you come into our department, we can provide you with the documentation that you need for that. Another benefit, this is not provided through our department, but it is a benefit when you retire for certain employees, is the post-employment health plan. And what that is it's a tax-free account. It is funded through a percentage of your sick leave accruals when you retire. And it is used for IRS qualified premiums and services. So it applies to firefighters, management, sheriff lieutenants, commanders, detention lieutenants, and probation officers. So it only is for certain employees. Participation in this program, if you are part of an association that is participating, it is mandatory. It's not an option that we have to opt out. And enrollment is automatic when you retire. The administrator for that benefit is Nationwide Retirement Solutions. And if you have questions about the post-employment health plan, you can contact them. That information is here. It's also in those packets that you have for health benefits, the planning guide. So all the information that I'm giving you right now, you don't have to write it all down. It's going to be in that planning guide if you need it. And so that's it for me. I'm available, and as well as the rest of the Kern County Health and Wellness team, Monday through Friday, 8 to 5. Someone's there for lunches, and you can come and sit one-on-one with myself or one of the other associates, and we can help you go through your different options. We can't make the choice for you, but we can hear what your situation is and try to give you as much information as you need to make a good decision for you when you retire. I know the health benefits is a scary part of retirement. I did want to just note too, because I got a call this week actually, and he said, well, nobody ever told me this. When you get your retiree health benefits and they become effective, you have not paid for those benefits yet because you haven't got your first pension. So just prepare that when you are enrolled in benefits and you get your first pension, you're going to have to catch up with any premiums that you owe because you start in that partial month. Normally a pay period doesn't end at the end of the month. I think this year we have one. October 31st is the last day of a pay period, which that doesn't happen often. So you'll usually have a partial month. Retirees pay in advance for their medical. So with September 30th premium, retirees are paying for October coverage. So normally by the time you get your first full pension, you owe a partial month, you owe the current month that we're in, and the month coming. So just be prepared for that because whatever your premium is, you're going to have that deduction, that larger deduction, and then you'll see it normalize the next pension check. Also, something to keep in mind is that there is a lag between you becoming on retiree benefits from active benefits because those eligibility files go to vendors and vendors have to upload those files. So even though you're eligible the first day that you start, the first day after your active employee benefits end, the vendors may not have your eligibility yet in the system. It could take up to 10 business days. So you want to make sure that if you have outstanding prescriptions, anything like that, you get everything beforehand because you're going to have that little delay that if you go to the pharmacy or you have your eligibility ran, that it's going to show that you're not eligible even though you are. Just be prepared for that. So just some things to look out for as you prepare to transition. So does anybody have any questions? Yes.
Health benefits because you're on your spouse's health benefit or retiree health benefit.
A penalty?
Yeah. If you don't, like, I'll be under my husband's health benefit insurance, so I don't need this.
Yeah. So we're not going to penalize you, but if you were eligible for county contributions, it could affect those. And again, everybody's situation is different, so it's better to go over those like on a one-on-one basis. But if you are eligible for county contributions and you don't choose retirement benefits through the county when you retire, you could be at risk of losing those county contributions. But other than that, there's no penalty. You can come back during an open enrollment time or if you have a permitting event. Yes.
Leave without pay affect those premium stipends like the big one, the 887? If you have leave without pay, but you're still considered an active employee, does that mess with the service years?
With your service years, I'm not familiar with, but as far as your eligibility for health benefits, no. You would still be able, once you retire, even if you were on leave without pay, you can still come into retiree health benefits. And if you had been paying into the stipend and supplement program and meet all the other criteria, then you would still be eligible.
Like between the 20-year and 25-year, say I had a year of leave without pay, not continuously, would that, maybe I'd be at 24 years instead of 25?
Yes, so when we verify your years of service, if it is under the 25, again, I don't calculate it in my department, but if it's under the 25, then you would qualify for the supplement if you met all the other requirements, but at the 24 year. So at the 90% versus the 100%. Yes. So the stipend is a smaller amount. The stipend is the $39.75 for one party. And then the supplement is the larger amount, depending on your bargaining unit. Yeah. Yeah, two different things. Stipend is a smaller amount that stays with you if you're eligible for it, as long as you're on continuous coverage, even past 65. The supplement is a larger amount that if you're eligible for it, you become ineligible at the age of 65. Mhm. Yes. No, so if you move out of state and you are no longer in a service area for the plan that you're on. So let's say you get on Network Plus and you move out of state. You have 30 days from that permitting event from the date of your move to switch plans, and you would not lose your stipend and supplement if you were eligible. But it's only that 30-day window. If we end up having to cancel your coverage because you moved out of state, you would become ineligible for everything. So again, you want to make sure that you communicate with our department and that you do everything timely. Yes. Yes.
I turn 65 in a month, in 1 month, and then don't retire. I'm not eligible to retire until 2 months after that.
Mhm.
When should I apply for the Medicare?
So you can apply for Medicare. I believe the soonest is 3 months before you need it to be eligible. So I would apply as soon as possible. Well, for you, you're an active employee. So again, you can apply for Medicare and have Medicare while you are an active employee. I can't tell you whether to do that or not, but if you have not applied for Medicare yet and you're 65 and you're going to be retiring and will need Medicare, you want to do that about 3 months before you need it to be effective. So if you were going to retire in December, you needed your Medicare to be effective December 1st, because remember, it's only the first of a month. You'd want to apply 3 months prior to that, just to give yourself enough time to get that eligibility and be able to enroll in a Medicare plan. Correct. Till you want it to be eligible. But for more questions on Medicare, we can't really counsel on Medicare. We don't do the Medicare piece, so you would want to contact Medicare. Yes. No, you would have to continue on retiree health benefits to get the stipend. So yes, you would have to apply for Medicare because you have to have Medicare Part A and B to come onto a retiree over 65 plan. So you would need to apply for Medicare, but you would be eligible for the stipend if you met that criteria for the stipend. Does that answer your question? Okay. Any other questions? Yes. Yes, to a county Medicare plan. So we do have several plans to choose from. It's also kind of the same thing as when you're under 65. Only certain plans you're able to enroll in if you're living outside of California. But you do have several options. And there's a lot of different information I can provide you on those plans if you want to come sit down with me, because there's different options. Mhm. Yes. No, so if you chose to get onto retiree health benefits and you're covering a spouse or another eligible dependent, you would get stipend based on how many people you're covering on your medical. So if you were the only one on your medical, but you're covering your family on dental and vision, it wouldn't apply. It only applies to who is on your medical plan. So with children dependents, you can cover your child till the age of 18. At 19, 20, 21, and 22, that child must be a full-time student and be certified as a full-time student. So you'll have to provide, it's called a student certification in order to cover your children. If they are under that age, under 18 and under, yes, you can still cover them on your retiree health benefits without student certification. Disabled is also, as long as the certification for the disabled dependent, we have to renew it every so often, then yes, that is another eligible dependent. Mhm. Yes. No, that's the supplement. The supplement is just till you're 65 if you are eligible for it. The stipend will follow you as long as you're on continuous health benefits. Or if you leave, come back, and you're re-enrolled for 3 consecutive years. Oh, which bargaining unit you are? I believe it's on our payroll stubs. It has our bargaining unit on there. And I can also, what was that? Oh, okay, yeah, and then we can also tell you that in our department. Mhm. Sherry, do I have more time? No time? Okay. Okay.
You know what I mean?
Yeah, so the county contributions, those are programs that you are participating in. If you look at your paycheck stub, there'll be little lines like where there's a line for your employee benefits. There is a line and it does say whether it's stipend or supplement if you are participating on it. If you don't have anything on your paycheck stub, you're not participating. If it's only the stipend, then you're only participating in the stipend program. So you can tell if you look at your paycheck stub. And that is the amount that if you participate in the program, that amount is being applied toward the cost of your medical premiums. Is anybody confused on that? I'm sorry? It is, I think it says RHPSP and the other one says stipend. And if you click on it, it gives you a little bit more information. It'll tell you what it is. Yes.
Is that what you meant by if I said, if I choose not to go with the health benefits, that I would be losing out on the county contributions? Is that referring to the supplement and the stipend?
Yes.
But to be eligible for those, you would have had to have at least 20 years.
Correct. So if you've been paying into the program, but you're retiring at 15 years, you wouldn't qualify. If you are of age, you're 50 when you retire, you've been paying into the program, but you know, you have 12 years of service, you wouldn't qualify. So you have to meet the qualifications for that program. Yes. So you're going to be eligible for, if you see the supplement, for the supplement and the stipend. But if you only see the stipend, you're not eligible for the supplement because you haven't been paying into it. So like if you were hired at a later age, like 46, you may be participating in the stipend, but not the larger amount, not the supplement. Yes.
We didn't have to pay into it because people were wondering what this portion was on our payroll until we opted out. So what about money that we have contributed and up until that point? Do we get anything at all back?
So that's dependent on your unique situation. It depends when you opted out. There was a period of opt-out where you may have money available to you. And if you not leave the county, but you retire from the county, you could qualify for that amount. That amount would be transferred into an account that you can use for qualified, IRS qualified services and supplies, kind of like how we use our FSA account. It's called a HSA, the health savings account. So that just depends on when you opted out. You would have received a letter that would tell you what you are eligible for. No, once you opt out, you opt out. And you opt out, if you opted out of the supplement program, you also opted out automatically of the stipend. So you wouldn't be eligible for either one. So that means when you're looking at the cost of the benefits, the cost that's listed on the chart is what you're going to pay. Since you guys have a lot of good questions, another question that hasn't came up that comes up often when I'm meeting with retirees is, what if my spouse is already 65 and Medicare eligible, but I'm under 65, or vice versa? That would be the only time, if you guys were going to be covered both under medical county insurance, that you guys can be on two different plans. So whoever is 65 and older would enroll in a Medicare plan, and the one that is under 65 would enroll in the under 65 plan. As soon as the one that is under 65 becomes Medicare age, you would have to follow that other person onto the same plan they're on. Another question I get is, if I want to cover myself under medical, but I want to cover my spouse under dental, as long as you, as the retiree, will also be on the dental, you can cover your spouse. You wouldn't be able to cover your spouse on dental and not you. So that's the one requirement, is whatever benefit you want your covered dependent on, you also would have to be on. With that exception of that, even with the medical, you would have to be on medical under 65 if you wanted your spouse on over 65. So they have to have the same type of benefit as you. Mhm.
Get a discount if you fly your spouse into the plan you.
So there are different rates, the one-party rate, the two-party rate. You would just be paying the two-party rate or the family rate.
So as long as my supplemental covers mine, I would just have to pay whatever.
Yes. Any other questions? Yes.
If we opted for the county's retirement insurance, then we would not have to enroll in Medicare?
No, so you have to enroll in Medicare Part A and B. And what you're doing by enrolling in another type of Medicare coverage is a couple things. You're either opting into, let's say, an HMO, and that is taking the place of your Medicare. You'll still be paying your Medicare premium for Part B, but you're adding additional benefits. They're either taking over your Medicare, you're getting something to supplement your Medicare, but you still have to be enrolled in Medicare Part A and B. And then depending on which plan you choose, you may also have to purchase a Part D. So there's so many different scenarios. I can't get into every specific one. So I do recommend if you're in those situations that you definitely come see us. Mhm.
The county insurance, y'all have a dental and, vision.
Yes,
Then you have the retirement, county retirement vision and dental. too.
correct. Just different options for you. So if you wanted a PPO plan, you don't want to do Cobra, or maybe you expired your Cobra and you're looking for a different PPO dental option, you can go through REOKC and see what they have available. So that's just additional options. Mhm. Any other questions? Yes. That's one of the requirements, is at least 20 years of service. There is an exception to that for service-connected disability, but that gets into a little more detail. So again, if you're not certain about your situation, definitely contact us so that we can go over your specific scenario. Yes.
I applied for Medicare.
Mhm.
I applied for Medicare Part A.
Mhm.
I was counseled not to apply yet for Medicare Part B because I'm still working for the county. So, any idea when will be the opportune time for us to enroll ourselves for Medicare Part B?
Yes, so you want to do that in enough time so that when you retire, you have that Part B.
3 months or, sorry.
Yeah. Yeah, I would definitely contact Medicare to find out what they suggest, but I know that it can't be 3 months prior to you wanting that coverage. So just go in enough time, because what if it takes 6 weeks to get it, 7 weeks? You want to make sure you have plenty of time so that by the time you retire, you have your eligibility, you know the date that you're eligible, and you're able to enroll in a supplemental or an advantage plan if you choose to. All right. Thank you, guys. You're welcome.
All right, thank you, Jocelyn. Those are great questions. The Health Benefits Office is located in this building, just left to the security desk. And also their information is on the printout. So most definitely make sure to reach out to them for any questions, and definitely before retirement so that you can get enrolled and get all of that taken care of. My name again is Sherry Willard. I am the Deputy Chief for the Member Services Division of KCERA. And as I mentioned, I have been with KCERA for 21 years. So I have many years ago, didn't even think about retirement. So my goal today is to hopefully fill in some gaps and voids for you and answer those unanswered questions for you. My team is also here. So after the presentation ends today, you can most definitely stop by and ask questions. So today we are going to go over a few different items: purchasing service credit, reciprocity, eligibility for retirement, which all of you are eligible because you're here with us today. Your pension benefit, retirement allowance options, what options are available to you when you get ready to submit your application packet, the benefit estimates that you run on the portal and what those look like. Death benefits, divorce in your retirement. Divorce can affect your retirement. Getting your ducks in a row, what all you need to do to prepare for retirement. The retirement application packet, some final details and some things just to keep in mind. How many of you have already registered for your KCERA member portal? Ooh, oh, that makes me so happy. Jeremy, that was wonderful. Did you see that? All right, I'm going to plug in the member portal a few times today. But if you have not registered for the member portal, it is a fantastic tool. We really do urge you to register for that because you can run retirement estimates like crazy. If you have service credit purchases that you're interested in, you'll need to run that estimate for the purchase in the portal as well. But it's a great way to stay in touch with your retirement account. But also, it's so beneficial when you get ready, when you are retired, because you're able to update your address through your portal. You're able to update your beneficiary, your direct deposit, but you get your 1099s through the portal. And KCERA does not mail out paper remittances every month for your pension payment, but they are uploaded into your member portal. So that portal is a fantastic tool, and we definitely recommend that you sign up for that. And if you are unsure how to, you can most definitely contact our office and we can get those instructions for you. So KCERA is a defined benefit, not a defined contribution plan. So what that difference is, a defined contribution plan is going to be like Voya or a 401k, where it's going to depend on how much money you put in there and how the market goes. KCERA, your benefit is based on specific factors. When you get ready to retire, your pension is going to be based on your years of service, your age at retirement, your final average monthly salary, and the benefit tier that you're placed in. And that pension's paid to you for the rest of your life. You're never going to outlive it. So it doesn't matter how much money is in your contribution balance. Now, that's where I wanted Jocelyn to explain that difference is your county contributions are different than your KCERA retirement contributions. You can see that retirement contribution balance in your portal. It is also on your paycheck stub, but it's down there under KCERA. So they're two different things. But your retirement contribution balance doesn't determine your pension. We use that balance. Once you retire, we use that to fund your pension. But once that balance is gone, your pension doesn't stop. It's paid to you forever. You're not going to outlive it. Whereas with, a defined contribution plan, you could potentially outlive that. Now, one of the factors was service credit. Obviously, every, biweekly that you complete, every pay period that you complete, you pay your retirement contribution and you get that retirement service credit in return. It's kind of like that quid pro quo, correct? One way to increase that service credit is by purchasing eligible service if you have it available to purchase. That's one way to increase that, one of those factors. The types of purchase, we have two different types that are available. We have prior county and district service, and then we have prior public service, and I'll explain the difference in the two. Prior county and district service is going to be like your extra help time, your waiting period. Your waiting period is from your hire date to your entry date into KCERA. It can be anywhere from 1 day to a full biweekly. That's called your waiting period. And that you don't pay a retirement contribution for that waiting period. That's purchasable. Any medical leaves for you, the member, now not family leaves or personal leaves, but if you took a personal medical leave of absence without pay, you could purchase that back and get that service credit back. Redeposit of permanent service. If you previously worked for the county or a special district, you terminated and you withdrew those funds from KCERA when you left, and now you came back 5-10 years later, you can redeposit that permanent service and get that service credit back. Now, purchasing prior county district service will go towards your vesting, which you are all vested already. You have over 5 years, and it will go towards your retirement eligibility. Once again, all of you are eligible to retire, but it's going to increase that benefit. No matter what type of service you purchase, whether it's prior county district or prior public service, it's not going to enhance any other benefit. So it's not going to increase your vacation or sick leave rate. It's not going to change your seniority date. It's not going to do anything except for enhance your retirement. So prior public service is going to be any public agency in the state of California, federal government, active military time. So if you worked for or if you were in the military for 4 years, you could purchase that 4 years of military time as prior public service and increase your pension when you get ready to retire. So if you work 20 years of service with the county, you purchase 4 years of military time through KCERA. When you get ready to retire, your pension will be based on 24 years, not the 20 that you worked. Same as with prior county and district service, it does not enhance any other benefits, and prior public service does not count towards vesting or retirement eligibility. So the process on purchasing service credit, it does have to be done through your member portal. So you have to run that estimate through your portal first. It's going to give you an estimate of what the cost would be, and it will give you like the payment options, payroll deduction options, and so forth. If that is doable and you go, yes, I want to purchase that time, that looks great. You have to do the official request. You can get that official purchase request right there in our member portal. You can get it off of our website. You can come by our office and fill it out, or we can send one to you. Once you submit that request form, then our staff will calculate the exact cost of that. They're usually pretty close to what the portal comes up with. And you want to keep in mind that every 6 months, interest is applied. That means every 6 months, purchase of service is going to get more expensive. So procrastination is not your friend. So if you do have service credit that you want to purchase or look into because you want to enhance your pension when you get ready to retire, I would look at it now and get that done sooner rather than later. And you have different payment options. You can do lump sum. You can do payroll deduction option, payroll deduction. You can do an accrual rollover where you roll over, your vacation, sick leave to pay for that purchase. Now, keep in mind, the auditors will calculate out the monetary amount of your accruals, calculate out approximately 42% on that supplemental tax, and then whatever's left is what's available to you for that purchase. So keep that in mind if that's one of the options that you're looking into. Or if you have a deferred comp account, you can do a deferred comp rollover. And that is taking from a tax deferred plan, rolling it over to KCERA to pay for that purchase, and it's tax deferred as well. Now, the great thing about doing a deferred comp rollover, in my opinion, is you're taking funds from your defined contribution plan that you could potentially outlive. You're rolling it over to KCERA to purchase service credit that's going to increase your pension that you will never outlive. So you're investing in yourself. So that's the way I look at it. But those are your purchase options. So I highly recommend go onto your member portal, run those estimates. If you have any questions, please reach out to our office. Our staff would be more than happy to help you with that. All right, reciprocity. This is a great benefit. This is another way to potentially increase your overall benefit. Reciprocity, this was created many, many years ago, and the purpose of it was to help promote public service. It's going to put a link between most California governmental agencies. And basically, if you worked for another governmental agency, let's say prior to coming to the county. So let's say that you worked for Tulare County. We have reciprocity with Tulare County. So you worked for Tulare County, but you only had a year with them. You left your funds in service on deposit. You didn't know what to do. You don't want to get taxed, crazy tax when you take it out. You came to KCERA. You became a member and started contributing into KCERA within 6 months or less from when you terminated with Tulare. You can establish reciprocity between those two systems. What that means is that your service with Tulare would go towards your vesting and eligibility for retirement with KCERA, and vice versa. Your years of service with KCERA will go towards your eligibility for retirement with Tulare. And when you get ready to retire, that's where it really comes in, is that even though with only 1 year with Tulare, you wouldn't have really been eligible for a pension with them because you only have 1 year. But because you're eligible to retire with KCERA and you have that reciprocal link, you will get a pension from that other agency for the service you had with them. And you'll get a pension from the service that you had with KCERA, but we're going to share salaries with them. So if your salary is higher with KCERA than what it was when you worked for Tulare, Tulare is going to use our salary to calculate that pension. So it could be 2-3 times higher than what you were making when you were with Tulare or that other reciprocal agency. So it's a fantastic benefit. It will also go the opposite direction. If you're leaving the county or special district, if you're leaving KCERA, and you're going to a reciprocal agency, you can establish outgoing reciprocity. So this is a fantastic option to keep in mind. If you think that you may be eligible for reciprocity and you're not sure if you established it many years ago, you can go to your member portal. It will tell you if you have reciprocity. Also, on your most recent annual statements that you guys received, it will tell you if you have reciprocity. If it doesn't and you think you should, give us a call, shoot us an email, and my team will be more than happy to look into that for you. When can I retire? Well, all of you can retire, or you're at least within 3 years of retirement. So for general members, general or safety, anyone can retire as long as they have minimum 10 years of service credit and they are minimum age 50. Now, for general members, they can retire at any age if they have 30 years of credit. This one's rare. I've had one in my entire 21 years. She was a unicorn, and she was 48 when she retired, but she had 30 years of service. And she did that because she purchased all of her extra help time. And when she was in high school, she worked a CETA program through the high school, and she purchased all of that time as well. And that got her to where she had 30 years of service by the time she reached 48. So she retired. Or age 70, member that turned 70, they can retire regardless of their service credit. And that's not uncommon. We've actually had a couple members, once they hit 70, they retired and they, had way less than 10 years of service. For our safety members, they can retire regardless of age once they hit 20 years of service. And so once again, it's not uncommon for us to have a 47, 48-year-old safety member retire once they hit that 20-year mark. How's it calculated? Where does it all start? Where does it go? Run your estimate in your portal. You'll definitely get those numbers, but it's going to be based on, we talked about, those 4 factors. One of those factors is the benefit tier that you're placed in. So we have 2 classifications. You're either a general member or you're a safety member. So our safety members are our sheriffs, our firefighters, our sworn in officers. Those are our safety members. The rest of us, we're considered general membership. And then in each classification, we have 3 different tiers. Tier 1, Tier 2, those we call our legacy, and then Tier 2 PEPRA. So I'll talk about PEPRA in a minute. What I first want to do is I want to explain what the 3% at 60 or 1.62 at 65, what those formulas mean. When you get ready to retire, your pension, we talked about those 4 factors, your years, age, and service, and then the benefit tier. If you decide to retire, you're a Tier 1 member, and you're at age 60, and you're ready to retire, and you've got, let's say, 30 years of service, you're going to get the maximum benefit of that 3% because you're retiring at age 60. You're going to get 3% for each of those years that you have with KCERA. So if you have 30 years of service, you're going to be entitled to 90% of your final average compensation with KCERA. So that if you retire under the age of 60, then you're not going to get that full 3%. It decreases. So at age 50, when someone is first eligible to retire, for a Tier 1 member, starting at age 50, it's 2%. And then it incrementally increases until they reach age 60, where it's going to max at the 3%. For Tier 2, it's 1.62 at 65. So in order to get that maximum of 1.62%, you would need to retire 65 or older. Now, it won't go higher than the 1.62 or higher than the 3% or for safety. Now, safety, I want to make a little footnote. It says 2 at 50. That's what it's called on there, but it actually is 2.62% at 55. So for our safety members, you could actually, for Tier 2 safety, you could actually work until 55, and that would get you the max, 55 or older, and that would get you the max of the 2.62. Not sure why it's called 2 at 50. I think it just kind of rolls off the tongue a little nicer. But it is 2.62 at 55, excuse me. So the Tier 2 PEPRA, that little PEPRA piece, if you see on there, the formula is the same, 1.62% at 65. It's the same for both. PEPRA is applied to anyone that was hired January 1st, 2013 forward. They are subject to that. They're classified under that PEPRA. PEPRA is the Public Employees Reform Act. Like I said, this became effective January 1st, 2013. It didn't really affect members that were hired prior to that date, but it did change some of the rules on how we apply the compensation part. But for those members after 1/1/13 who are in that PEPRA, these are really the main three. There's several different factors on it, but these are really the three main ones. If you want more detail on PEPRA, you can most definitely go to our website and type in PEPRA on the Ask Jan. We have a wonderful chatbot feature on our website, and you don't have to even do full sentences. You can just type whatever you want in there, and she will provide you with links and everything that is found within our website. So it's a wonderful tool to use. But you can ask Jan, you can just type in PEPRA, and she will provide you with more detailed explanation of it. But the three high points for anyone hired after that 1/1/13 who is subject to PEPRA, it's basically changing the pensionable compensation. There's special pays that are not pensionable for PEPRA members that are pensionable for our legacy members. So that's our tier 1 and tier 2 for general and safety. It also changes how the final average compensation, we call it the FAC, how that is calculated. So for our legacy members, it's the highest 12 consecutive months of salary. For PEPRA, it's going to be your highest 36. And then the contribution rate may be lower for those PEPRA members as opposed to the legacy. One of the things on the salary that I wanted to mention real quick on the FAC, the highest consecutive, when we go to calculate your salary at retirement, it's your highest consecutive. So it doesn't necessarily have to be your last 12 or last 36 months. So if you changed jobs or you took a voluntary demotion, whatever the case may be, and you're making less now than what you did a couple of years ago, when you go to retire, the system is going to pull your highest 12 consecutive, even if that was from a few years ago. When you run those estimates in your member portal, you can actually see what FAC period it's pulling. And I'll go over that a little bit more when we get further to the benefit estimates and show you where to look for that. So we have a beautiful picture here of Mr. Jones and his little grandson. Mr. Jones retired. And so I wanted to kind of give you an example of how that formula works. He was a tier 2 member. He put in 25 years of dedicated service, and he was 65 when he retired. So he's going to get that maximum 1.62% for each of his 25 years. That puts Mr. Jones at being eligible for 40.54% of his FAC, of his final average compensation. Mr. Jones is, through his career, his final average compensation for his highest 36 months averaged out to $6,000. So he's going to be receiving a gross benefit from KCERA for the rest of his life of $2,432. That's the gross benefit. So it would be subject to taxes. And he will also be eligible for the annual cost of living increases that we give every April 1st to our retirees. So if you retired, this is why you see a lot of people retire. You see that big rush by the end of March, is because people are wanting to retire before the April 1st cutoff so that they can pick up that COLA. It's a maximum 2.5%, and it's a compounded COLA. So, it's been a pretty steady 2.5% maximum for the last several years. So that's just going to increase that benefit annually for you. But that's why you see a lot of members want to retire by the end of March so they can pick up that COLA. So even if you retired March 15th, you're going to pick up that COLA. If there is one for that year, whatever that percentage is for that year, you will pick that up as of April 1st. Yes, ma'am.
So is you know how we got those printouts recently?
They
are percentage with the retirement,
the printout,
the benefit thing that just.
the annual statement?
Yes.
Yes, ma'am. Yes, the annual statement you just got.
That 40% be on that annual statement?
Yes. Yes, that is exactly. So her question was on the annual statements that you received, it's showing at if you're currently eligible, it'll show that current date, and then it'll show 60 and I believe 65. And then it shows the years of service, the benefit amount, and then it's showing you the percentage. That's the percentage. So for Mr. Jones, it would say 65, 25 years, 40.54%. Okay. All right. So these matrices, yes, ma'am. So the reason I didn't put dates is because with different departments, so like the Superior Court, hospital, county, the dates, the eligible dates can change, but depending on when you were hired will determine what tier you were in. If you go to your member portal, it will actually tell you. So if you were hired prior to, if you're a county employee and you were hired prior to October of 07, and ooh, I'm pulling this off the top of my head, you would be tier 1. But double check that with your portal. Like I said, I'm pulling that off of my fractured memory. Yes, ma'am.
But 1.62 at 65, but if you retire, say 3 months shy of 65, is that 1.62 decrease?
Yes, so her question was if you are a tier 2 PEPRA and you retired 3 months prior to 65, is that going to be less than 1.62%? Yes, it will. Every quarter that you get older, your age changes every quarter. So these are things that if you reach out to my team, they will look at that. If you're only like a couple of weeks away from your next quarter on your age factor, they will look at that and go, actually, if you went 2 weeks later, you'll pick up your next quarter on your age factor and it'll increase your benefit to X amount. And you can also run those multiple estimates in your member portal so that you can see those differences. Whatever date you put in there, yes, it's going to use that. So if you put in your birthday, your 65th birthday, it's going to use the 1.62. But if you put in 6 months prior, it's going to do a lower factor. All right. So in on our website, in the member handbook, we have these wonderful matrices. We have them for tier 1, tier 2, both for general and safety. The reason why I think these are wonderful is you use this in conjunction with your member portal, running an estimate. You're running that estimate in the portal and it's going to provide you with an estimated monetary amount. But for some of us, I'll get to you in 1 second. Some of us want to see what is my actual percentage. I know when I retire, I need to be at 75% of my salary in order to survive, because that's what, this all adds up to on my calculations for my personal self. This matrix, the years of service are on the I guess it would be on the left side vertically, your age is horizontally, and then you're going to match it up. So for Mr. Jones, retiring at 65 with 25 years of service, there's the 40.54%. I'm going to go here. If you back it up, so this is where it would be good to show, if Mr. Jones retired at age 60, he would have 20 years of service. He would have been at 25.58%. So if you just track it down each year in a diagonal line, you can see how that percentage increases. So this is a wonderful tool, like I said, to use in conjunction when you're running that estimate on your member portal. And like I said, we have these for all the different tiers, and they're out in our member handbook, out on our website. And it's usually around the end of the handbook. I think it starts at around page 26 of the member handbook. You can go to the website and on Ask Jan, just type in member handbook and it will pull these up for you. Yes, ma'am. So her question was, when you run an estimate on the portal, will it take into account the COLA? No, it does not. The estimate that you run will not project your salary either. It's using the salary that you've earned up to that point in time, because the portal is linked to the retirement administration program that KCERA staff use when running your finals and your calculations and so forth, but it will not add in that COLA. It does not take that into account. So you would just want to add that into the calculation yourself. So our question was, would we recommend waiting till your next birthday? That's going to be, each person's different. I would recommend contacting our office and speaking with one of my analysts so that they can look at your personal situation and go over all that with you. It may not make a difference. It just kind of depends. When you take that COLA into account, it may not make a difference. For instance, my birthday is in August. If I retired at the end of March and be able to, and pick up that COLA, I would actually end up with a higher percentage, overall percentage, as opposed to if I waited until my August birthday. So my team, the analysts, they take all that into account. So that's why it's just really best. Run those estimates, and then those pointed questions, definitely reach out to us. All right, so we're going to talk about the options now. When you get ready to retire and you're filling out your retirement application packet, we have 5 options and 1 enhancement. And I'm going to go over those. I'm not going to go too deep into them because there's so many different caveats with personal situations, but I will give enough information to hopefully answer some questions today. So the unmodified option, this is the maximum highest benefit that you can get as a member, regardless of whether you're married or not. This is going to give you that highest benefit. If you are married or a registered domestic partner, it will automatically leave a 60% continuance to your spouse or partner in the event you predecease them. This option also allows you to change your beneficiary. So if you name a sibling and something happens, let's say you get married later after retirement, and now you want to name your spouse as your beneficiary. You can change your beneficiary from your sibling to your now new spouse. And as long as your spouse is minimum age 55 and you have been married at least 2 years, they would be entitled to that continuance. Now that's after you retire. If you get married prior to retirement, as long as you're married at least a year prior to retirement, then the age does not matter. So if you are married 20 years before you retire, and then, 5 years after you retire, you pass away, your spouse is only 54, they're still going to get that continuance because you were married for more than a year prior to retirement. So that age factor on the spouse or registered partner is only after, if you get married or registered after retirement. Now, this option also, if you have a minor child, and minor means under the age of 18. So if you, when you retire, you are naming your minor child as your beneficiary, you pass away, as long as that child is under the age of 18, they are going to receive a 60% continuance until they turn 18. Or they can continue to receive that until they turn 22 if they stay enrolled in a full-time in an accredited school. So this is definitely, something to think about, but this is the most common option with members because it gives you that flexibility to change your beneficiary. It's giving you the maximum benefit. And if you're married or a registered partner, you're not having to take a reduction in your pension monthly to leave a 60% continuance to your spouse or partner.
On that, the last bullet point, let's say you're married, you change, less than, you haven't been married for years, you pass away, will it revert back to the prior 6 years?
So her question was, if you get married after retirement and they are not, you hadn't been married the 2 years or they weren't age 55, would it revert? It would not revert. They would still be the beneficiary. They would receive the one-time $5,000 death benefit if applicable. They'd receive the final pro rata. If there was a contribution balance remaining, they would receive that. They just would not be eligible for the continuance. So You are not required to name your spouse as your beneficiary. However, California is a community property state. So if you and your spouse or registered domestic partner decide that it's whatever your personal situation is and they want to waive their rights as your beneficiary, there is a form that would need to be signed by both of you, and both of you separately would have to be counseled. The form would have to be notarized. We do offer that in our office. So if this is something that might apply to you, you would want to contact our office and speak with one of our analysts so that we can go more in detail with you and explain this on a little bit deeper level on all the specifics. But that is an option now. It was not previously, but that is an option now available to members once you retire. I mean, even prior to, but that is out there. All right, option one. This one's not real common. It is the only option that allows you to name your estate. There is no continuance, but what it's going to do is it's going to slightly reduce your monthly benefit. And, you know, as I stated before, with your contribution balance, when you retire, we're going to reduce your contribution balance. We're going to use that balance first to fund your pension. So we're going to reduce that contribution balance every month by your full pension amount. That balance is going to be depleted within a couple of years or less, but then your pension is going to continue to be paid to you for life. Option one is going to draw that contribution balance out a little bit longer because we're only going to deduct an annuity amount every month out of it instead of the full pension amount. So if you pass away, let's say you name a sibling on option one and you pass away prior to your contribution balance being depleted. So let's say you pass away a year after you retire, your beneficiary will receive whatever is left in your contribution balance. There's no continuance to them. But if you pass away 10, 12 years after retirement, that contribution balance will definitely, more than likely, it's going to be completely depleted. And your beneficiary will only receive the one-time $5,000 death benefit if applicable. There would not be a contribution balance available to them. So it just takes the contribution balance and draws it out longer. But you're taking that slightly reduced benefit amount. But this is the only one that will allow you to name a legal certified bona fide estate. Option two. This is a lower benefit amount to you, but it's going to leave a 100% continuance to your named beneficiary. The beneficiary does not have to be an eligible spouse or a registered domestic partner. So if you have an adult child and you want to leave a lifetime continuance to them, you can do that with this option, but you are locked in with your beneficiary. If you are engaged and you want to name your fiance as your beneficiary and you want to ensure that they're going to get this continuance because they're, you know, there's a chance they might not make the age eligibility if you pass away, but you cannot change your beneficiary. You're locked in with whomever you choose. So if something goes awry, you want to keep that in mind before you sign those final papers because it is irrevocable. When you retire, your option is also irrevocable. So when you sign those final retirement papers, whatever option you've elected at that point in time, that's the option you're locked in with. And then depending on the option that you choose, your beneficiary is irrevocable as well. You can't change that. Option three, this is also a lower monthly benefit amount to you, the member. It's not as low as the option two, but this leaves a 50% continuance to your beneficiary. So if you pass away, your beneficiary would receive a 50% continuance of that benefit. And once again, this does not have to be an eligible spouse or registered domestic partner. And you cannot change your beneficiary for any reason after retirement, even if these beneficiaries predecease you, if they pass away before you. We highly recommend you always name a secondary beneficiary because the final prorated check still would need to be paid out to someone. So let's say you chose option 3, but your beneficiary passed away before you. And now, time comes and you've passed away. You passed away on the 15th of the month. There's those 15 days of that month that needs to be paid out to someone because we owe that to you. So this is where your secondary beneficiary would come in at. We could pay those 15 days to that beneficiary. And then if your account is eligible for the one-time $5,000 death benefit, that would also be paid out. So we highly recommend always name a secondary beneficiary. That's this one. I will go, yeah. Good timing, good timing. So option 4 is a lower monthly benefit amount to you. It's going to leave 100% continuance, so it's similar to option 2, but this option allows you to name multiple beneficiaries. So if you have 2 adult children and you want to name both of them, you could choose option 4 and you can either split it 50-50, or if one's your favorite and you do 75-25, we've had that. It's sticky. Don't do that to us, but you can. You like one sibling over the other, however you want to do that. As long as the total adds up to 100%. So like if you have 3 children, you could do, 33.3, 33.3, and 33.4, or, 70 and keep going, the benefit is going to be based on the youngest beneficiary. And this is the same for option 2 and 3. So the way that it works is the reduction that you're going to take in your monthly benefit, the hit that you're going to take in your monthly benefit, it's going to be based off of the youngest beneficiary, because when you pass away, that benefit's going to continue for quite some time if that youngest beneficiary is quite a lot younger than you. So it could be a decent reduction that you're taking monthly. I highly recommend, if you're considering one of these modified options, and when I say modified, I mean 2, 3, or 4, contact our office, reach out and speak to one of our analysts so that they can go in a little bit, more in detail with you and, go over your personal situation and the ins and outs and make sure that that is, the option that you really are wanting. And same as with the other modified options, you cannot change your beneficiary for any reason. So if you pass away and one of your 2 beneficiaries are receiving that continuance, one of them passes after your death, the other does not absorb that percentage. That's gone. They still only get their percentage. Okay. So definitely things to think about. Yes.
I was in your office not too long ago, and I think, is this the option that they send to a different company to figure
Yes.
out, so it's a little bit longer?
Yes, the process is a little bit longer because we do have to send it off to our actuary for them to do the official calculation of it. We can run estimates, and our estimates are pretty close.
So you can pre-do it before you actually retire, so you can see that.
We can run an estimate beforehand. Yes, we can run an estimate beforehand. So the enhancement is the temporary annuity option, and this does not apply to everyone. The temporary annuity option is a way to level out your monthly retirement income. That sounds great, but there's some little caveats in there. If elected, if you choose to take the temporary annuity, basically what we do is, if you're eligible, you have to first be eligible to draw Social Security. You have to be integrated with Social Security. So if you're in a special district that is not integrated with Social Security, you would not be able to choose this. If you are over 62 or going to be over 62 when you're retiring, you would not be eligible for this. What we do is you have to provide us with an estimate from Social Security of what your benefit from them is going to be at age 62. We take that estimate, and based on your retirement age, you're eligible for a percentage of that Social Security amount. KCERA will front that or advance that percentage to you every month until you turn 62. So let's say, for instance, you're retiring at 50 and your Social Security estimate at 62 is $1,000. Based on age 50, you would be looking at probably about 33% or so that we would be able to advance to you. So let's say $330, just make it really clean and easy. We're gonna advance that $330 to you every month until you turn 62. When you turn 62, KCERA is going to permanently reduce your Kern County check by the full $1,000 that you're now going to be getting from Social Security. We don't reduce it by the 330, we're reducing it by the full 1,000 because now Social Security is paying you that 1,000 and that's how you get that level income, okay? It can put some people in a pickle. I highly recommend, if this is something that's piquing your interest, contact our office and talk to our analysts so that they can go in more detail with you on this, because it may not be the best option for you. So definitely reach out and talk to the team if this is something that may be of interest, though. All right, so how many of you have ran estimates in your member portal? Oh, I love that. I love it. Yes. All right. So this probably looks a little familiar. I think this might be an older version. I probably need to update it. When you run your estimate, you're going to see typically the unmodified and option 2. And then you're going to see tabs across the top. Options, general, service, earnings. So of course your options tab is the options, the benefits available. Your general tab is just your different demographics, your department, your age, when you entered, what tier you're in, and so forth. Your service, this is what's going to show you how much service you have up to the estimate date that you ran. Now the system, if you're doing an estimate date, a retirement date for 5 years out, the system will project the service. It will not project the earnings. So it'll project that service, but it's also going to include any service purchases that you've already paid for. It won't show any that are in progress, but if you've paid for it already, it's going to show that in there for you as well. And then your earnings. This is where you, when you run that estimate, when I mentioned the highest 12 consecutive months or highest 36, this is it's going to show you that period on that earnings screen. And so it could be your current 12 or 36 months. It could be an older period. And then what it's also going to show you is all of the special pays that are comprised in that FAC period. And it'll tell you if they're pensionable or not. So this is where it really comes in handy for the PEPRA members, so they can see, you know, I'm receiving the 6% premium pay. Premium pay is pensionable. Or legacy members, I'm receiving a uniform allowance. Uniform allowance for legacy members is pensionable. So I've got longevity. That's pensionable for the legacy members. So this is going to list that out for you on that earnings tab. So definitely make sure, you know, you're clicking on those little tabs so you get a lot more information there. So the benefit amount. So for Mr. Doe, Mr. John Doe here, his benefit amount, if he's chosen this date, the maximum benefit to him on that unmodified option is $25.39 and change. If he is married or he has a registered domestic partner, someone that's eligible for that continuance, their 60% continuance of that benefit is $15.23. Now, if you run this estimate, but your beneficiary that you have listed is not eligible for that continuance because it's your sibling, then, or, you know, your neighbor, your friend, fiance, whatever the case may be, they wouldn't be eligible for that 60% continuance, but it's still going to show that death benefit amount. It's still going to show that continuance amount because that could be an option because you're able to change that beneficiary in the future. Okay. And then option 2, that's going to show you if he chose option 2, it's going to reduce his benefit down to $23.94 and change, but it's going to leave 100% continuance to his spouse or registered partner, or whomever he has listed. Now, if he had a minor child or even let's say a sibling that is a lot younger than him listed as his primary beneficiary and he's choosing option 2, you're going to see that death benefit amount for the survivor, for the beneficiary, it's going to be lower. It's not going to be equal. All right. So if you have any questions on that, if you're running those estimates and you see that in your estimate and you want to know why that's different, definitely reach out to our office and our staff can explain that to you and go over all of those options with you in more detail. Yes, ma'am. So our question was, does the estimate include extra help time that you've already purchased? Yes. So on that service tab, it's going to show all of your service, your total benefit service, and then it's going to list it out. It's going to show your continuous service. It's going to show any purchased service that you have in there, and it'll even list it out if it's, tier 1 or if it's safety time, it'll list it all out there for you. And it'll also show the reciprocal. Now, the reciprocity, real quick, for reciprocity, your years of service in the reciprocal system, KCERA does not pay for those years. Those years are paid by your other system. Those years will be seen on your service tab, but it's only for eligibility purposes. It is not included in your retirement calculation. And if you think you had a higher salary at the other agency, that's not going to be reflected here either. It's only going to show your KCERA salary. Yes, ma'am.
Is a surviving person that has an insurable interest in you, what does that mean to you guys?
Basically, if you named the mailman, this is the easiest way for me to explain it. I have to break it down, make it simple. If you name the mailman has no interest in you living, like you aren't providing shelter for him, helping. I mean, you could be, but the interest in that person's in your life and their well-being is different than what it would be for a sibling or a child or a parent, a fiance, etc. So. See, she threw the loophole, the mailman being the son. All right, I had another, yes, ma'am.
Able to choose option 1, 2, 3, or does it just?
I believe for married members, and Corey, you can correct me if I'm wrong, because I know you go into the screen probably a little bit more than I do. Now, for married registered partners, it's only going to show the unmodified and option 2, but for unmarried individuals, it's going to show the unmodified and option 1. Yeah. So, yeah, because that you'd want to contact us, and we can run that estimate for you. Yeah. Yes, sir.
If you were to keep availability pay or on-call pay, is that all, are those two types of pay pensionable as well?
So, you're going to want to go to your member portal and look in the earnings tab, and more than likely, yes, but I don't want to say yes because I don't know your specific situation, what tier and so forth. So I would say go to your member portal and look in the earnings screen to see if those are pensionable. But you can also go to our website and you can go to Ask Jan and type in special pay code list. And that's going to give you a list of, she'll pull up and give you a link to it. And that'll give you a list of all of the special pays, and it'll tell you which ones are pensionable for legacy versus PEPRA. And if you have problems with that, you can't really figure it out, give us a call or shoot us an email. We'll be more than happy to help you. Yes, ma'am.
You said they come up with the amount of the pension, but does it decrease based on the highest salary? But does it decrease the salary, the pension from the highest salary, say? So you're going to get 2 pensions, correct? And they're going to take the highest of either salary. If the lower one, when they come up with their amount of pension, does it take from the higher one?
So our question was on the reciprocity and how the shared salaries work. So if you have reciprocity coming from another system and the salary with KCERA is higher than that other system's salary, they're going to use our salary to calculate your pension in that system. No, they're 2 totally separate paychecks. So you get your pension from them for your years with them. You'll get your pension from us for your years with us. And it's based on whatever salary is higher, but there's not a reduction. Yeah. Yes, ma'am, way in the back.
Tablet shows the taxes that are being paid out. It shows it as a single rate.
Yes.
That's all we're gonna stay where even if you're married?
For the, so our question was on the taxes on the estimate. That's just an estimate. We have the taxes set as the single rate, but when you go to retire, there's tax forms, and I'll get into that on future slides. But you choose whatever taxes you want taken out. All right, so on the post-retirement, once you pass away, there is a one-time $5,000 death benefit that is paid to your named beneficiary or beneficiaries. And I've mentioned this $5,000 a couple of times. It's for retired members only. So you pass away and your survivor is getting the continuance. When they pass away, there's not a $5,000 death benefit that would be paid out again. It's only paid out one time, and it's to you, the member's beneficiary. It's paid by the last California County retirement system. So the exceptions to the retirement systems on that would be CalPERS, CalSTRS, and FERS, the federal employment. So let's say, for instance, you had reciprocity from CalPERS to Kern County, to KCERA. When you pass away, your beneficiary would receive the one-time $5,000 death benefit from KCERA, and they would also be eligible for whatever death benefit CalPERS would pay out to them. But if your reciprocity came from Tulare County, then they would only get the $5,000 death benefit from KCERA. And then the continuance to your named beneficiary or beneficiaries is going to be dependent on the retirement option that you chose at retirement, whether it was the unmodified or one of the modified options. All right, so we talked about divorce once before. We're going to talk about it again. So your pension is considered an asset and subject to the community property laws. So if you got divorced or terminated a registered domestic partnership during your career, if it happened prior to you ever coming to work for the county or special district, it does not matter to us. It's only during your career. KCERA must have a copy of those divorce documents. We have to have those because when you get ready to retire, we cannot place you on payroll if that divorce has not been reviewed and approved by our legal team. They have to review all those divorce documents. If you are in the middle of a divorce, if you're separated and you're going through that process, please reach out to our legal team because they will review those divorce documents for you to make sure that KCERA is listed in there properly and to make sure that if there's any split of benefits, that it is something that KCERA can do because we do have to abide by the retirement laws. This is another thing in addition to the buybacks where you don't want to procrastinate. Procrastination is not your friend. This is another thing that's not. If you've been divorced, you are unsure whether you've submitted those divorce documents to KCERA, please contact our office immediately. Shoot us an email through the portal, call us so that we can verify whether we have those. You don't want to wait and submit your divorce documents at the same time as you submit your retirement application packet. Because like I said, that can delay you going on payroll. Because if there's something in those divorce documents and you left KCERA out, you guys just, oh, well, you just keep it and I'll keep mine. And so you just left it silent. That can pose a problem. You may have to go back to court and get an addendum or adjustments. So definitely get that taken care of sooner rather than later.
You'll need those, need the death certificate. I've been told two different things.
So her question was if the spouse passed away after the divorce.
Yeah, I put it in the divorce, but I did my own divorce, so it
Okay.
might not be right, but he has since passed away as well.
Okay, so her question was, what if you've been divorced and she's not retired yet, but her former spouse has now passed away? Provide us with both, a copy of the death certificate and the divorce documents. Get those sent to our legal team, legal@kcera.org, or you can upload them into your member portal because you are able to upload documents into your member portal now. And that way our legal team has time to review the divorce docs. And if there's anything additional, if there's any questions, we can get that all resolved before you get ready to retire. All right, so what should you do approximately 6 months before your estimated retirement date? You want to get your ducks in a row. You don't want wild chickens. I have wild chickens. They're nowhere near ready. So you want to get those ducks in a row. You want to run that estimate on the portal. You want to contact KCERA if you have additional questions. You've got those unanswered questions you need answers to. So you want to confirm that service credit eligibility requirements. So like what Jocelyn was talking about on the 20 continuous mark, and every year it increases the percentage that you're entitled to that supplement. You want to hit those milestones. So if you're unsure on where you're at with your continuous service mark, reach out to us so that we can help you make sure that you're at the right point of where you want to be. If you have questions, unanswered questions on the retirement options, including the TAO, contact us. If you have service credit purchases that are in progress and you're doing payroll deduction and you see that I'm planning to retire, in 3 months, but I've still got, 6 months left on my purchase, contact us so that we can do a payoff amount, because those have to be paid off before you retire. You want to make sure that you know what to do with your accrual, what you're going to do with your accrual balances, kind of get a game plan. Are you going to take a payout on your vacation and CTO, your comp time? You're going to get paid 100% of that, regardless of how many years you have. But your sick leave, that is paid at a percentage based on your years of continuous service. You're going to want to refer to your MOU or speak to your HR department to determine what percentage and what you're subject to. But you want to figure out what you're going to do with those. Are you going to take a payout? If you take a payout from your employer when you retire, they're going to tax that supplemental tax. So you're going to get hit with that probably 42%. Or are you going to roll it over? This is a perfect opportunity. If you've got a deferred comp account, roll that into deferred comp and you're rolling it in tax deferred, and then you can do with it what you want later. Liliana is the next presenter and she'll go over that more, but that's an option for you. If you don't have a deferred comp account, this would be a great time to open one so that you have that availability when you get ready to retire. You can open one with just a mere $25 a month, and it's pre-tax. But like I said, she'll go into all of that. Yes, sir.
Is there any requirement difference between the paid and the comp time? Are all options the same for both? Can I roll them over if I wish for both?
Yes.
Or pay out for both?
Yeah. So even if, you roll the sick leave, if you're only entitled to 75% of your sick leave. Now for fire, you guys are different because you have the other plan. But for your vacation and comp time, yeah, you can roll all of it. You can roll part of it. You don't have to roll all of it. If you go, I want to take part of it lump sum and then I'm going to roll the rest of it, or I want to use part of it as vacation and then roll all the rest of it, you can do that as well. Now, I don't like the term terminal vacation. It sounds, kind of so I call it transitional vacation. I promise, before I retire, I'm gonna get a petition going to get this changed. So when I say transitional, you guys are all gonna know that I mean terminal vacation. So this will something that you want to do. You definitely want to make sure that you contact your payroll clerk prior to the start date. So what you want to do is go in and figure out, this is when I want to retire. This is how much vacation I have. This is what I'll accrue, and kind of back it up and figure out this is when I could start my vacation. Talk to your payroll clerk prior to that start date. Your department has to approve that. KCERA cannot calculate that vacation for you. We don't have anything to do with that, but you do have to get it approved from your department. So you do want to make sure you talk to your payroll clerk. And reciprocity. Yes, sir.
You get the COLA that comes April 1st, you have to make sure that you were off of the vacation and retired prior to that date.
So his question was, if you want to make sure that you pick up the April 1st COLA, would you have to end your transitional vacation before that date? Yes, because If you're on transitional vacation, you're still an active employee. You have to retire on or before April 1st in order to pick up the COLA for that year. Yes, ma'am.
Should retire at the end of a pay period. So does that mean the day after you get paid or that Friday end of the pay period?
So her question was retiring at the end of a pay period. So we highly recommend that you make your last day of the pay period, if you're going to retire, try to make the last day of the biweekly your last day employed, and then the following day, which would be a Saturday, that would be your first day of retirement. The reason is you don't get partial service credit. So if you retire after, midway through that biweekly, you're not going to get retirement service credit for that whole biweekly. Some members, it doesn't bother them. For members who are taking, the transitional vacation, it happens because they're wanting to burn up all of those hours that they have. And so it may take them in the middle of a pay period. And being able to burn up all of those vacation hours is more important than getting, that one extra biweekly of service credit. So it just depends on your personal situation. You don't have to retire at the end of pay period, but we highly recommend it. It makes it a lot cleaner for, everyone, including you. So reciprocity, one last talk on this. If you have reciprocity established, you definitely want to make sure that you contact the reciprocal agency prior to your retirement date, because you're going to need to retire from them on the same date that you retire from us. And that doesn't mean submitting your paperwork on the same day. You have to use the exact same retirement date in both systems in order to keep that reciprocal benefit intact. That reciprocal agency will also provide you the information that you'll need from their system, which would include their retirement packet, how to fill that out, how to submit that to them. They could probably even give you an estimate if you have went into your member portal and you've ran your estimates with KCERA. You'll know what your FAC is. They might be able to give you an estimate based on that. All right, so we are 6 to 8 weeks before the estimated retirement date. At this point, it kind of reminds me when you're coming from a long trip and you're at the top of the mountain over there coming up 58 and you're, about coming through Tehachapi and you're like, you can see everything and you're like, yes, I'm almost home, 45 minutes. This is what this point reminds me of. You're like right there at the top of 58 and you're coming down, or 99 or I-5 coming home. All right, so you want to get your retirement application packet. The packet's going to contain the application itself, a beneficiary designation form. It's going to have an authorization for direct deposits or a direct deposit form, and it's going to have the tax forms in there as well. Now, your pension, like I mentioned before, is subject to federal and state taxes, but KCERA will only withhold taxes for California. So if you move out of state, we will not withhold taxes for that state. You will get a 1099 every year, and you will have to take care of your state taxes on your own, unless you move to a state that has no state tax, like Florida or Texas, just to name a couple of the many that are out there. And then you would only, have your federal. Now, we cannot accept the application packet, and there was a member that had walked up, walked up and asked me that question, and I can't find her here, but this is for you. We cannot accept your application any sooner than 120 days or 4 months prior to your elected retirement date. The only loophole to this is if you're on transitional vacation. So if you're taking vacation and you got like 5 months out because you're maxed on your, he's like, yes, that's me. Because you're maxed out on your vacation and comp time, whatever the case may be. And you got 5 months, you can submit that application packet to us as soon as you start that vacation. And we highly recommend it, because once you get in that vacation mode, you're like sipping Mai Tais with the cute little umbrellas, you're on the beach, toes in the sand, and you are not thinking about KCERA paperwork at all. So we want to make sure you get that paperwork to us. Yes.
So you have your maximum accrual vacation, and you want to go ahead and do that transitional vacation. But you want to make sure you get it all done before the end of March, because you want to go into the COBRA. So can you use your transitional vacation, take you till about February, and then whatever you've got left from your vacation, take that February till the end of March and transfer that into your deferred comp?
So if you're planning to retire like February,
Yes.
okay,
I have 600 hours of vacation. But if I write that out, it's gonna take me past March. And I wanna retire before April 1st.
okay, yeah, so,
That's-
yeah, whatever's left.
I can roll into a deferred comp, FOIA. Yes.
Yeah, so our question was, would she be able to use as much of that vacation to get her to her retirement date? And then at that point, if whatever she had left, would she be able to roll it into, you know, deferred comp or cash out? Yes. That answer it? Yeah. Yeah, exactly. Yes, yes, you can. Yes, yes. Yeah, I don't want to lose it, but yes, you can roll it for sure. Our packet is interactive online, so it's, you know, really easy to fill out. To submit it, you can actually send it to us via secure email, and our staff can initiate that secure email. But we actually prefer if you do it through your member portal. You can submit documents through your member portal now. And so we highly recommend that you do it that way, but that packet is interactive. Now, we do require a clear legible copy of your current driver's license or government issued ID, a copy of your marriage license or state registration if you, for domestic partners if applicable, copy of those divorce documents, preferably we want those long before this point, right? If you have a spouse that passed away, and you have not provided us with a copy of that death certificate, then you want to make sure you get us a copy of that death certificate as well. Once we get that packet, you are going to receive a timeline from us within 2 to 3 business days. That timeline is going to provide you with, this is your final day on payroll. This is your first day of retirement. They're going to be 2 different days. This is the date your final employment paycheck will be, you know, paid out to you by your employer. This is the first month you're going to be on KCERA payroll. And if there's any missing documentation, it's going to list that out. And it's going to tell you, this is when KCERA is going to be contacting you to come back and sign or make arrangements for you to sign your final papers. Because even though once you submit that application packet, you still have one more set of final retirement papers that we need for you to sign. Now, we can do that electronically. You don't have to do it in person, but we can do that electronically. But there is one more set that you do have to fill out. And then the REOKC packet, if you come in person, if you've made an appointment, you come in to submit that, we'll provide that packet to you in person, like Corey had mentioned, or we will mail that to you if you submit that application packet to us electronically. Yes, ma'am.
Those have already been submitted earlier in your career, like divorce or whatever. Do you have to resubmit those?
So her question was on like the documents. Do you have to resubmit them if you've already submitted a copy of the divorce documents or a death certificate? No, we don't need those again if we've already received them. If you've submitted, let's say in the past you did a beneficiary change and you provided us with a copy of your driver's license, yes, we will need a new fresh copy of that when you submit the packet, but the divorce documents, death certificates, we don't need duplicates of those. How many have this little check mark going on their bulletin board? Put a bean in the jar, you know, whatever. All right, so contacts and final details. Yes, ma'am. Was it before you started working for the department? It doesn't matter. You have to, that's still, there's a year of community property. Her question was, if the divorce was 25 years ago, does she still have to submit the divorce documents? But she was married for a year while she was employed. That is still community property. So yes, we have to have a copy of those divorce documents. Yeah. Yes, ma'am. You can. Her question was, can you bring those in? You most definitely can bring those in and we'll make a photocopy of those and provide them to our legal department. Yeah. All right. So You do have to advise your department that you are retiring. I know some members want to just kind of shimmy out the back door into the night and see ya. But you do have to let your department know. The reason why you have to let your department know is common courtesy, but at least a 2-week notice. Your department has to generate what's called a change of employee status form. You guys have probably seen them. You might have signed them, a CES. That has to be generated, taking you from active employment to retirement. That CES is what's uploaded into our system with when your final paycheck is paid out to you. We cannot calculate your pension. We cannot put you on retirement payroll. We can't do anything unless that retirement has uploaded into our system. We can't do anything. So it's really important that you let your department know at least a couple of weeks minimum. Let them know that you're retiring. They'll have exit forms and stuff for you to sign. And then health benefits, as Jocelyn mentioned, you definitely, within 30 days of that retirement date, contact them, make sure that everything's in order. For any court employees, you want to make sure that you talk to your HR division or whoever handles your benefits. And the same with any of our other special districts, speak to your HR division, whomever handles your benefits. You want to talk to deferred comp? I seen Liliana walk in, so she'll be coming up after me in just a few minutes. So you want to make sure that you reach out to her in a timely manner. Strata, American Fidelity, Union, if you have any of these deductions coming out of your paycheck, they will not roll over to your retirement. They stop. So if you have your mortgage with Strata or your car payment or a life insurance through American Fidelity, you want to make sure that you contact them ahead of time and you make arrangements to set up another avenue to pay them, because you do not want to have any lapse in coverage, because it will not roll over to KCERA. Now, Strata, you can set it up to have that deduction come out of your pension, or you can make other arrangements with them, but it is not an automatic. So I don't want anyone to have any missed payments or loss of coverage. So please make sure you take care of that. And then of course the reciprocal agencies, you want to make sure that you contact them so that you keep that reciprocity intact, retire concurrently, and submit all documents and packets timely. So a few items to keep in mind. We cannot provide an income verification prior to your first deposit from KCERA. Please don't go out and buy a mansion, buy an island, buy a hockey team. Wait until after you get your first deposit from KCERA, and then we can provide you with an income verification. But prior to that first deposit, we cannot help you. On that note, when you retire, retirement is once a month. Paydays are directly deposited once a month, always on the last business day of the month. If that last business day falls on a weekend or a holiday, it's per your bank's discretion on whether they release it before or after, okay? When you retire, you will, let's say for instance, you retired October 15th. You would more than likely be on KCERA's November payroll. We pay in arrears. So your payday is on the last day. It would be, your first full deposit would be November 30th. That's going to be for that whole month of November. It's not going to be for December. It'll be for that whole month of November. So what happens is in that month of November, that very first month, you're going to get 2 deposits. You'll get a retroactive payment around the middle, 3rd week of November, and that would be for those remainder days of October. So from October 15th through October 31st, you'll get that retroactive payment around the middle of the 3rd week of November. And then on November 30th will be your first full deposit. That would be for the whole month of November. And then your paydays will continue to be once a month, always on the last business day of the month thereafter, okay? As I mentioned before, we do not mail out paper remittances. So you will need your member portal if you're wanting to see that remittance every month. You can safely rescind your retirement up to the day prior to your elected retirement date. That's the safe zone. You can do it prior to your first deposit, but it gets pretty sticky. It's up, that's something between you and your department. That gets really sticky also with, health benefits, deferred comp, and so forth. So that's why we say safely up to the day before the retirement date. Except for if you're on transitional said it, transitional vacation. And then the cost of living adjustment is applied, like I mentioned, April 1st of every year. It's not a guarantee that if it's going to be the full 2.5%, but like I said, it's been pretty steady the last, several years. And it is a compounded COLA, which is wonderful. So just keeps getting bigger and bigger. Yes, sir.
For the direct deposit, do we need to provide KCERA with our bank information? Or is that-
Yes. Great question. His question was on the direct deposit. Do you need to provide anything? Thank you. Yes. On the direct deposit form, it does not allow you to write in the information. And the reason is we have to have either a voided check. You have to be on that bank account. You can't have somebody else on that account. We can't deposit into anybody else's account. So a voided check or an account verification form that you can get from your bank's website. If you go in, log into your account through your bank, you can print it out that way, or you can go into your bank, into the brick and mortar, and they can physically give you an account verification form. And that's got your routing number and account number, but it also should have your name on there. And you'll want to provide that to us as well. And then all of our contact information is here. If you, the QR code, if you click on that, that's going to take you right to our website. Our member services email, when I say, reach out to our office, my analysts be more than happy to help you. You can also email us at memberservices@kcera.org, and that will be fielded out to one of my team members. And then our legal team is at legal@KCERA. Back here, yes, ma'am. Her question was, if you do elect to take a payout at the end, how long does it take to get that check? I believe it's paid out with your last employment check. It'll be lumped in with that. You're welcome. Yes, sir. So his question was, if you retire and after some time you decide you want to come back to work, if there's any special ruling. Yes, there are. So there are limits on how much time, whether you do like a retired extra help position, or you actually come back as a retired employee. So a retiree return to work. So you're coming back in a full position, paying contributions and all of that. There are stipulations. So I would recommend, because it goes into a little bit more than what I have time for today, I would recommend contacting our office and speaking with one of our team members, and they would be able to answer those questions in a lot more detail than what I could right now. You're welcome. All right. Any other questions? Yes, ma'am. So our question was on the one-time $5,000 death benefit, if it's the same for everyone or if it's different for management. No, it is not like the county insurance, life insurance. If you pass away as an active member, that $5,000 death benefit for when a retired member passes away is a flat $5,000 death benefit, and it is taxed, the federal and state as well. But yeah, it's just a flat 5,000. Just a couple of things. One thing I wanted to mention, you had mentioned like CalPERS. You want to make sure that if you have reciprocity established from a reciprocal agency to KCERA, you cannot withdraw those funds from that reciprocal agency because you have to keep those intact in order to keep the reciprocity. So I just wanted to make that one little point. So on your agenda for today, just a reminder of that survey. If you could do that for us before you leave or during your lunch hour, we would greatly appreciate it. And when you exit today, my team will be in the back and they will provide you with the attendance confirmations that you will need. So ladies, if you'll get those in hand. If you have any, personalized individual questions on any of the content today, please contact each agency, and all of us, we're all here to help you. We want to help you, get the information that you need in a timely manner. Our hope for today is that you leave here armed with the knowledge to help you in your transition into retirement and to make it as smooth as possible. We hopefully have alleviated, if not eliminated, all of your fears and anxieties and answered, the questions so you have a better grasp on the process. For KCERA, please contact us. Let's see. Oh, nothing else on there. All of our information is in the packet. Please don't hesitate. Contact us. Don't get your information from, Bob over in IT or Jane over, in the cafeteria or something. Contact each agency and ask those questions. Thank you again for joining us. We really appreciate you. Congratulations on your upcoming retirement and drive safe. Thank you.